Hello, I'm Dr. Binay Yadav. I'm one of the medical teachers at Kathmandu University School of Medical Sciences, and I'm also a junior doctor at Dutikal Hospital. And I involve myself with teaching students about the clinical practices and methods during medical school. And one thing that I have come across in new medical students is that oftentimes these new students have very difficult to understand how to study in general, because for vast majority of their life they have been studying in one particular way, and for many of them it works, but for many of them it might not be the best effective way to study, and they really want to discover new things and new methods which often the elite students do or practice to make their grades better, and I am here just to help you with that. So one thing that one must consider is that the sense of completion as a human being is a very deep or engraved necessity that we think, because all of us want to complete the task 100% before moving on to the next, and that is one of the basic human nature. But in studying, that might not be always the most best thing to do, because there are many researches and studies which show that leaving some task incomplete often helps you to do that task in the best of the ways. Let me elaborate on that. So let me give an example. So if you want to study a topic, let's say osteosarcoma or osteosarcoma, then what you would do is, as a medical student, is the medical student will start to study from the epidemiology, the risk factor, etiology, pathogenesis, clinical features, histopathology, and then complete it with treatment and complications and prognosis. But what happens in doing so is that you have this chunk of information, a lot of information that you have to complete at once, and you feel like, I will not move to the next topic until I am done with the osteosarcoma, and you get stuck because some things you do not understand, because you are not meant to understand everything in the first year of medical school. What happens is that you get stuck in the loop of trying to cover that particular topic you don't understand, and so what happens is that you move on to the next thing without understanding it fully. And some medical students, what they do is they try to read and use different textbooks to understand the same topic until they get it fully. But in doing so, you lose lots and lots of time, and you might not have completely understood the topic. So my technique that I used to follow in medical school is that always calm yourself down and let yourself know that it is not necessary to know each and everything in the very beginning of the medical school. So for example, when you are studying osteosarcoma for this week, maybe try to learn only about the histological finding of osteosarcoma. So just know that in osteosarcoma there are cords, plates, and excessive proliferations of osteogenic tissue, or the bone tissue, which appears eosinophilic on the HNE stain, and that's it. Let it ruminate for about 1 week or 5 days, 10 days, and then you will ask yourself you will yourself ask a question. Okay, I know that it looks something like this in histology. Gee, I wonder how is it different from Ewing sarcoma? Or it looks so bad in histology, there is all this kind of bone proliferation. How will it affect the human being, or how will it what will be its clinical features? So there will be a question that will come to your mind on its own. You are not studying it because it is there in the textbook, you are not studying it passively. You got a question by actively thinking about the histology of the disease, and this question will have a greater impact for you when you try to search the answer of that question the next week. And after doing this enough, you will have bits and pieces of knowledge about this disease over a period of few weeks or months, and at the very last, what you can do is you can summarize all these things and try to study it all at once. So this is one very handy technique that I used to follow. It might not be practical for each and every one of the students. That is something that I used to follow, and I found it very helpful. There are some study papers and articles as well which have some evidences supporting this theory that incomplete information can be memorized much earlier than a complete information. Well, that is all for today, and I will see you in next video.